Question 1. A sterile processing (SP) technician is actively unboxing and assembling a newly purchased 10-pound laparoscopic instrument set in the decontamination area. To properly mix the enzymatic detergent for the first manual soak, the technician reads the manufacturer instructions for use, IFU. What is the primary reason the U.S. Food and Drug Administration, FDA, requires the manufacturer to provide this validated IFU to the facility? A. To maintain a centralized database of all hospital medical device purchase records. B. To ensure the reusable device can be safely and effectively cleaned and sterilized by SP technicians. C. To verify the minimum effective concentration, MEC, of the high-level disinfectant used on the device. D. To certify that the enzymatic detergent recommended is environmentally safe for drain disposal. Correct answer B. Knowledge point explanation. Core rationale. According to FDA regulations, manufacturers must validate that their reusable medical devices can be properly cleaned and sterilized. The FDA strictly requires the provision of a validated IFU to ensure SP technicians have the exact parameters, time, temperature, chemicals, needed to make the device safe for the next patient. Trap analysis. Option A is wrong because record keeping of purchases is a facility management duty, not an FDA IFU requirement. It would be correct if discussing the hospital internal materials management software. Option C is wrong because checking the MEC is the daily physical task of the SP technician using a test strip, not the manufacturer responsibility. It would be correct if asking about the daily quality assurance of high-level disinfection. Option D is wrong because environmental safety of chemicals is regulated by the Environmental Protection Agency, EPA. It would be correct if the question asked about the EPA jurisdiction over chemical disposal. Concept extension. The FDA regulates the manufacturing of all medical devices, Class 1, 2, and 3, and requires a 510(k) pre-market notification for most new devices to prove they are substantially equivalent to existing safe devices. Question 2. While physically assembling a complex 15-pound vascular tray in the prep and pack area, a sterile processing (SP) technician diligently scrubs their hands with soap and water at the designated sink, restricts unnecessary traffic, and ensures no unsterile items cross the clean stainless steel workspace. By performing these specific physical actions to prevent microbial contamination, the technician is strictly applying the principles of A. Continuous quality improvement processes. B. Aseptic technique. C. The Occupational Safety and Health Administration, OSHA, bloodborne pathogens standard. D. Standard precautions. Correct answer B. Knowledge point explanation. Core rationale. Aseptic technique is defined as any activity or procedure performed under controlled conditions to prevent the contamination of a sterile field or device. Hand washing, maintaining one-way workflow, and keeping clean areas isolated are direct physical activities of aseptic technique designed to protect the patient from infection. Trap analysis. Option A is wrong because a quality improvement process is an administrative tool used to analyze errors, not a physical infection control action. It would be correct if the scenario involved conducting a root cause analysis after a sterile processing failure. Option C is wrong because the OSHA standard focuses on protecting the employee from blood and body fluids using PPE, whereas aseptic technique protects the patient. It would be correct if the technician was donning a fluid-resistant gown in the decontamination area. Option D is wrong because standard precautions assume all blood and body fluids are infectious and dictate PPE use. It would be correct if the technician was handling heavily soiled instruments directly after surgery. Concept extension. Asepsis is the absence of pathogenic microorganisms. Medical asepsis reduces the number of organisms, while surgical asepsis completely eliminates them. Question 3. A sterile processing (SP) technician is manually brushing a heavily soiled orthopedic reamer under the waterline in the decontamination area. To safely contain the potentially infectious aerosols generated during this rigorous brushing and prevent them from drifting into the adjacent clean prep and pack area, the environmental airflow in the decontamination room must be actively maintained at A. Negative air pressure, exhausting air directly to the outside. B. Positive air pressure, pushing air out into the adjacent hospital corridors. C. Neutral air pressure, recirculating the air through the department standard HVAC system. D. Negative air pressure, maintaining a constant room temperature of exactly 75 degrees Fahrenheit. Correct answer A. Knowledge point explanation. Core rationale: the decontamination area must be maintained under negative air pressure. This means the air pressure inside the room is lower than the surrounding areas, causing air to flow into the room and preventing contaminated aerosols from escaping. This dirty air must then be exhausted directly to the outside environment, not recirculated. Trap analysis: option B is wrong because positive air pressure pushes air outwards, which would force contaminants into clean areas. It would be correct if the scenario was about the airflow in the operating room or sterile storage area. Option C is wrong because neutral pressure does not contain aerosols, and recirculating decontamination air is strictly prohibited. It would be correct if asking about general office ventilation spaces. Option D is wrong because while negative pressure is correct, the temperature setting of 75 degrees Fahrenheit is too high. It would be correct partially if the temperature was strictly maintained between 60 degrees Fahrenheit and 65 degrees Fahrenheit as required for the Deccan area. Concept extension: the decontamination area also requires exactly 10 air exchanges per hour to constantly dilute and remove airborne contaminants. Question 4. A transport cart containing 40 pounds of used instruments from a total hip arthroplasty arrives in the decontamination area. The sterile processing (SP) technician notices the instruments are completely covered in dried blood because the surgical team failed to apply an enzymatic pre-treatment spray. According to strict SP standards, where should the initial step of the decontamination process have actively started to prevent this hardened soil? A. Inside the automated mechanical washer disinfector upon arrival. B. At the point of use immediately after the surgical procedure concludes. C. Inside the ultrasonic cleaner using a cavitation process for 5 minutes. D. At the designated manual washing sink utilizing a triple enzyme detergent. Correct answer B. Knowledge point explanation. Core rationale: the golden rule of sterile processing is that decontamination begins at the point of use in the operating room. The surgical team is responsible for removing gross soil and applying a transport gel or damp towel to keep instruments moist. This prevents the formation of biofilm and stops soil from drying, which makes subsequent cleaning in the SPD significantly harder and damages the instruments. Trap analysis: option A is wrong because mechanical washers are used much later in the workflow, and hardened soil will block the washer jets. It would be correct if asking about the final step of the decontamination process before moving to the clean side. Option C is wrong because the ultrasonic cleaner is for removing soil from hard-to-reach crevices after manual cleaning, not the first step. It would be correct if the scenario asked how to remove fine soil from the box locks of a hemostat. Option D is wrong because manual washing happens after the instruments arrive in Deccan, which is too late to prevent the initial drying. It would be correct if the question asked for the first physical cleaning step performed by the SP technician upon receiving the cart. Concept extension: allowing blood to dry on stainless steel instruments leads to pitting and corrosion due to the high chloride content in blood. Question 5. After spending 2 hours manually brushing lumen instruments, a sterile processing (SP) technician removes their heavily contaminated heavy-duty gloves and fluid-resistant gown to go on a mandatory break. To comply with strict infection control protocols regarding cross-contamination, where must the technician perform their final hand hygiene before leaving the department? A. In the primary 3-compartment sink currently used for soaking the soiled instruments. B. At a dedicated hand-washing sink located exclusively within the decontamination area. C. At the designated hand-washing sink located just inside the clean preparation and packaging area. D. Using a waterless alcohol-based hand rub while walking out through the hospital main public corridor. Correct answer B. Knowledge point explanation. Core rationale: hand hygiene is critical in infection prevention. In the decontamination area, a dedicated hand-washing sink is legally required. Technicians must never wash their hands in sinks used for instrument cleaning due to high bioburden, and they must wash their hands immediately upon removing PPE before touching doors or leaving the dirty area to prevent spreading pathogens. Trap analysis: option A is wrong because the instrument sink is heavily contaminated with blood and tissue. It would be correct if the question asked where a rigid endoscope should be leak tested. Option C is wrong because entering the clean prep and pack area with contaminated hands violates the strictly enforced one-way workflow from dirty to clean. It would be correct if the technician was about to start assembling a clean tray after arriving at work. Option D is wrong because hand sanitizer is insufficient when hands may be visibly soiled or after removing deck and PPE, and walking into public corridors before cleaning hands spreads contamination. It would be correct if a nurse was leaving a standard patient room without visible soiling. Concept extension: hand washing must physically scrub all surfaces of the hands and fingers for a minimum of 20 seconds, prioritizing mechanical friction to physically detach microorganisms. Question 6. A newly hired sterile processing (SP) technician is physically pushing a transport cart containing a delicate 5-pound orthopedic battery-powered drill from the operating room, or to the decontamination area. When the clinical educator stops the cart and asks who is primarily accountable for preventing physical damage to this expensive device during its complete life cycle, what is the strictly correct response according to SP standards? A. The primary scrub technician assisting the surgeon during the operative procedure. B. The assigned SP technician working in the negative pressure decontamination area. C. The facility biomedical engineering department that performs preventative maintenance. D. Every single healthcare professional who physically handles the instrumentation. Correct answer D. Knowledge point explanation. Core rationale: proper handling of instrumentation is a continuous chain of responsibility. Every single person who handles the instrument from the surgical team in the OR to the transport orderly, the decontamination tech, the assembly tech, and the storage personnel shares equal responsibility for its proper care to ensure patient safety and prevent costly damage. Trap analysis: option A is wrong because the scrub technician responsibility is limited to point-of-use care like wiping blood and keeping it moist. It would be correct if the question specifically asked who is responsible for removing gross soil immediately after the surgeon uses it. Option B is wrong because the Deccan Tech only handles one phase of the reprocessing cycle. It would be correct if asking who is responsible for manually brushing the drill crevices. Option C is wrong because biomedical engineering focuses on electrical safety and repairs, not daily handling workflows. It would be correct if the drill required its annual electrical leakage test. Concept extension: dropping a heavy instrument like a drill can misalign internal gears. All staff must use two hands when transporting heavy trays and never stack items on top of delicate cameras or power tools. Question 7. A sterile processing (SP) technician is physically wiping down the clean assembly workbenches with an approved hospital disinfectant during a local respiratory virus outbreak. To ensure the correct application and environmental safety protocols are followed, the department relies on guidelines from the federal agency specifically responsible for investigating disease outbreaks and issuing public health emergency guidelines. Which agency published guidelines is the department following? A. The Occupational Safety and Health Administration, OSHA. B. The Centers for Disease Control and Prevention, CDC. C. The U.S. Food and Drug Administration, FDA. D. The Association of Perioperative Registered Nurses, AORN. Correct answer B. Knowledge point explanation. Core rationale: the CDC is a U.S. federal public health agency that is not a regulatory body, but rather issues critical guidelines. Its primary mission is to protect public health by responding to health emergencies, investigating disease outbreaks, and providing scientifically backed infection prevention guidelines for healthcare facilities. Trap analysis. Option A is wrong because OSHA is a regulatory agency focused on worker safety like PPE and bloodborne pathogens, not general disease outbreak guidelines. It would be correct if the manager was updating the policy on employee sharps injuries. Option C is wrong because the FDA regulates the manufacturing of medical devices and sterilizers. It would be correct if checking the validation requirements for a new biological indicator. Option D is wrong because AORN is a professional organization that writes clinical guidelines for operating room nurses. It would be correct if looking for best practices regarding sterile field setup in the OR. Concept extension. Although CDC guidelines are not technically laws, many regulatory bodies like TJC or state health departments use CDC guidelines as the standard of care, essentially making them mandatory during audits. Question 8. A surgical technologist has just finished a 4-hour bowel resection procedure. Before transporting the biohazard cart down the public hospital hallway to the sterile processing, SPD, decontamination room, the technologist places all soiled instruments inside a rigid puncture-proof container and secures the lid tightly. According to strict infection control standards, what is the primary purpose of this specific transport enclosure? A. To significantly accelerate the manual cleaning process once the cart reaches the decontamination area. B. To prevent the physical loss of small instrument components during transit. C. To prevent cross-contamination of airborne pathogens to patients, staff, and the environment. D. To maintain an internal temperature of exactly 75 degrees Fahrenheit for the soiled instruments. Correct answer C. Knowledge point explanation. Core rationale. Point-of-use transport must utilize closed, labeled, and leak-proof containers. The absolute primary goal of this requirement is infection control. Enclosing the heavily soiled instruments prevents the aerosolization of blood and body fluids, thus preventing cross-contamination to the hospital environment, unsterile corridors, and unprotected individuals during transit. Trap analysis. Option A is wrong because while point-of-use treatment like applying enzymatic gel accelerates cleaning, the physical enclosure itself does not. It would be correct if the question specifically asked about the purpose of a pre-treatment spray. Option B is wrong because preventing instrument loss is a secondary inventory management benefit, not the primary infection control goal. It would be correct if asking about the purpose of a surgical count sheet. Option D is wrong because transport containers do not regulate temperature, and 75 degrees Fahrenheit is irrelevant here. It would be correct if asking about the maximum ambient temperature allowed in the sterile storage area. Concept extension. All transport containers holding contaminated items must prominently display a fluorescent orange or orange-red biohazard label as mandated by OSHA. Question 9. A sterile processing, SP, technician is physically wiping the exterior of a soiled transesophageal echocardiography, TEE, probe received from the cardiology department. Knowing this delicate ultrasound instrument passes directly through the patient esophagus during the procedure, how must the technician classify this device based on Spalding criteria, and what is the minimum required reprocessing level? A. Critical device requires terminal steam sterilization at 270 degrees Fahrenheit. B. Semi-critical device requires high-level disinfection, HLD. C. Non-critical device requires wiping with a low-level quaternary ammonium disinfectant. D. Critical device requires immediate use steam sterilization, IUSS. Correct answer B. Knowledge point explanation. Core rationale. According to the Spalding classification system, the esophagus is an intact mucous membrane. Any device that touches intact mucous membranes but does not penetrate sterile tissue is classified as semi-critical. Semi-critical items must undergo, at an absolute minimum, high-level disinfection, HLD, to destroy all vegetative microorganisms and most bacterial spores. Trap analysis. Option A is wrong because the probe does not enter the bloodstream or sterile tissue, and steam sterilization would melt the delicate electronics. It would be correct if the item was a stainless steel cardiac retractor. Option C is wrong because the esophagus is a mucous membrane, not intact skin. It would be correct if the item was the external ultrasound transducer used on the outside of the chest. Option D is wrong because IUSS is for emergency sterilization of critical items, not routine TEE probe care. It would be correct if a dropped sterile cranial drill was urgently needed back in the OR. Concept extension. TEE probes are extremely fragile. The distal tip contains the expensive piezoelectric crystals, while the handle is strictly not waterproof and must never be fully submerged during cleaning. Question 10. A sterile processing (SP) technician is physically inspecting a newly processed batch of disposable arthroscopy shavers under a lighted magnification lamp in the preparation area. The technician discovers a cracked plastic housing right out of the sealed packaging and brings it to the supervisor to voluntarily report this manufacturing defect to the federal government to ensure patient safety. Which specific federal program should the facility use to submit this report? A. The Safe Medical Devices Act, SMDA, Mandatory Registry. B. The Centers for Disease Control and Prevention, CDC, Active Alert System. C. The Joint Commission, TJC, Sentinel Event Reporting Database. D. The Food and Drug Administration, FDA, MedWatch Program. Correct answer D. Knowledge point explanation. Core Rationale. MedWatch is the FDA Safety Information and Adverse Event Reporting Program. It is designed for healthcare professionals and the public to voluntarily report significant problems, defects, or adverse events related to medical devices, drugs, and biologics when no serious injury or death has occurred. Trap analysis. Option A is wrong because the SMDA requires mandatory reporting by facilities to the FDA and manufacturer only if a device causes serious illness, injury, or death. It would be correct if a defective shaver had broken off inside a patient knee joint causing severe injury. Option B is wrong because the CDC handles disease outbreaks and infections, not device manufacturing defects. It would be correct if reporting a cluster of unusual surgical site infections. Option C is wrong because TJC Sentinel events involve unexpected occurrences involving death or serious physical injury in a hospital setting. It would be correct if a patient died due to a medication error. Concept extension. Class 1 recalls are the most serious type of FDA recall, issued when there is a reasonable probability that the use of a defective product will cause serious adverse health consequences or death. Question 11. After spending 3 hours manually scrubbing heavily soiled orthopedic reamers, a sterile processing (SP) technician steps into the designated doffing area to remove their heavily contaminated personal protective equipment (PPE) before going on break. To strictly comply with infection control protocols regarding the most contaminated surfaces, which specific item must the technician physically take off first? A. The fluid-resistant long-sleeved gown. B. The heavy-duty decontamination gloves. C. The transparent face shield and protective mask. D. The slip-resistant shoe covers. Correct answer D. Knowledge point explanation. Core rationale. The universal principle of doffing removing PPE is to remove the most heavily contaminated items first to prevent transferring bioburden to cleaner areas or the wearer body. In the decontamination area, the floor is considered the most contaminated surface due to splashed blood, water, and chemicals. Therefore, the shoe covers are always the first item to be removed. Trap analysis. Option A is wrong because the gown is removed later in the sequence after the shoe covers and gloves. It would be correct if the question asked what is removed immediately after the gloves. Option B is wrong because gloves are the second item removed, as the hands must still be protected while touching the highly contaminated shoe covers. It would be correct if the shoe covers had already been removed. Option C is wrong because the face shield and mask protect the mucous membranes and are the least likely to contact gross soil, so they are removed last. It would be correct if the question asked for the absolute final step of doffing before hand hygiene. Concept extension. A standard OSHA-compliant doffing sequence in the decontamination area is 1 shoe covers, 2 gloves, 3 gown, 4 face shield or goggles, 5 mask, followed immediately by thorough hand washing for at least 20 seconds. Question 12. A sterile processing (SP) technician is physically assembling a 15-pound gallbladder surgery tray at a clean stainless steel workstation. The recipe card calls for a specific retractor used in a cholecystectomy. To physically place the correct item in the tray, the technician deduces the instrument targets the gallbladder by identifying the cholecyst section of the word. In medical terminology, this core structural section is known as the A. Prefix word element, B. Suffix word element, C. Root word element, D. Combining vowel. Correct answer C. Knowledge point explanation. Core rationale, medical terms are built using specific components. The root word element is the absolute core foundation of the term that carries its fundamental meaning. It typically identifies the specific body part or organ involved, like gastro for stomach, cardi for heart, cholecyst for gallbladder. Trap analysis. Option A is wrong because a prefix appears at the very beginning of a word and modifies the root indicating size, number, or direction, like hyper for above or excessive. It would be correct if the technician was identifying the hyper in hypertension. Option B is wrong because a suffix appears at the end of the word and usually indicates a procedure, condition, or disease like ectomy for surgical removal. It would be correct if the technician was trying to figure out what surgical action was being performed. Option D is wrong because a combining vowel, usually O, has no meaning itself. It simply connects word parts for easier pronunciation. It would be correct if asking about the O in gastroenterology. Concept extension. Medical terminology heavily relies on Greek and Latin origins. Knowing common roots allows SP technicians to accurately assemble specialty trays even if they have not memorized every specific instrument name. Question 13. A sterile processing SP technician is physically unloading a heavy metal rack containing newly disinfected orthopedic retractors from the automated washer disinfector. To strictly adhere to the facility infection control architectural design regarding the one-way flow of materials, what is the only acceptable physical path the technician can take with these instruments? A. Pushing the rack directly from the soiled decontamination area into the clean preparation and packaging area. B. Transporting the rack directly from the clean preparation area back into the unrestricted public corridor. C. Moving the rack back into the main decontamination room to wash the next incoming load. D. Moving the rack from the sterile storage area directly into the clean assembly zone. Correct answer A. Knowledge point explanation. Core rationale. The most critical design principle of the SP department is the strict forward one-way flow of materials to prevent cross-contamination. The physical movement must always progress from dirty soiled to clean prep and pack to sterile storage. Moving disinfected items from the decontamination side into the clean preparation side is the only correct forward progression. Trap analysis. Option B is wrong because taking clean instruments into a public corridor breaks the controlled workflow and exposes them to environmental contaminants. It would be correct if a delivery driver was dropping off an unopened cardboard shipping box. Option C is wrong because taking items that have just completed the thermal disinfection cycle back into the dirty decon room immediately recontaminates them. It would be correct if the wash cycle had failed or aborted prematurely. Option D is wrong because moving from sterile storage backward into the clean assembly zone violates the forward flow principle. It would be correct if the question asked for an example of a workflow violation. Concept extension. To maintain this one-way flow, SPD architecture often utilizes pass-through windows and double-door pass-through washer disinfectors that create a physical barrier between the dirty and clean sides. Question 14. A sterile processing SP technician is physically receiving a complex 25-pound loaner implant set from an orthopedic sales representative at the physical boundary line of the prep and pack area. Before allowing the representative to physically step across the red line to help inspect the trays under the illuminated magnification lamp, the technician must enforce the strict dress code for A. Restricted area, requiring the representative to don sterile surgical gowns and sterile gloves. B. Unrestricted area, allowing the representative to wear standard street clothes and a visitor badge. C. Semi-restricted area, requiring the representative to wear hospital laundered scrubs and a dedicated head covering. D. Biohazard area, requiring the representative to don heavy-duty gloves and a fluid-resistant apron. Correct answer C. Knowledge point explanation. Core rationale. The clean preparation and packaging area is classified as a semi-restricted zone by traffic control standards. To enter this zone, all personnel including vendors and visitors must wear facility-provided hospital laundered scrub suits and a surgical head covering like a bouffant cap that completely contains all hair. This prevents human skin squams and hair from falling into the clean instrument trays. Trap analysis. Option A is wrong because sterile gowns are only required in the sterile field of an operating room during surgery, not in the SP prep area. It would be correct if the vendor was scrubbing in to assist at the surgical table. Option B is wrong because street clothes shed massive amounts of lint and bacteria and are strictly banned from clean areas. It would be correct if the vendor was waiting in the hospital cafeteria or front lobby. Option D is wrong because biohazard PPE is specific to the negative pressure decontamination room. It would be correct if the vendor was examining a bloody instrument that just arrived from surgery. Concept extension. Facial hair like beards or mustaches must also be completely covered in a semi-restricted area using a specialized beard cover or snood. Question 15. A sterile processing SP technician is physically dispatched to the operating room or core to retrieve a biohazard cart containing heavily soiled reamers from a 3-hour total knee arthroplasty. Before physically pushing the cart down the public hallway, the technician vigorously sprays an enzymatic transport foam directly onto the bone-covered instruments. Which of the following is not a direct physical goal of applying this foam? A. Ensuring the biohazard transport cart arrives at the decontamination room within exactly 2 hours. B. Facilitating the removal of gross soil and bodily fluids before they can dry and harden on the surface. C. Preventing environmental cross-contamination by keeping the bioburden contained and managed. D. Preventing physical damage to the delicate instrument mechanics caused by dried blood corrosion. Correct answer A. Knowledge point explanation. Core rationale. Point-of-use treatment involves the immediate physical actions taken to prepare the instruments for safe transport and easier cleaning. The physical goals are removing gross soil, preventing blood from drying which causes corrosion and damage, and preventing cross-contamination. Transporting the cart within a specific time frame is a logistical administrative metric, not a direct physical goal achieved by the act of spraying the instruments. Trap analysis. Option B is wrong because keeping the soil wet directly facilitates removal. It would be correct if the question asked for the primary physical purpose of the spray. Option C is wrong because containing the soil with a spray foam directly reduces the chance of dried flakes becoming airborne, thus preventing cross-contamination. It would be correct if asking for an infection control benefit of the foam. Option D is wrong because blood contains corrosive chlorides, and keeping it moist directly prevents pitting and physical damage. It would be correct if asking why we do not let saline dry on stainless steel. Concept extension. If a prolonged delay in transport is unavoidable, the staff must use an FDA-cleared extended-time enzymatic gel or wrap the instruments in a towel moistened with sterile water, never saline, to prevent biofilm development. Question 16. A sterile processing SP technician is physically delivering a sterile loaner tray to the operating room, or core, and must physically hand it across the red line to the circulating nurse without contaminating the sterile wrapper. To ensure this physical handover meets national best practices for perioperative nursing, the technician is strictly following the published clinical protocols of which professional organization? A. The Occupational Safety and Health Administration, OSHA. B. The Association of Perioperative Registered Nurses, AORN. C. The Joint Commission, TJC. D. The Association for Professionals in Infection Control and Epidemiology, APIC. Correct answer B. Knowledge point explanation. Core rationale. AORN is a professional organization specifically for nurses. They publish evidence-based guidelines like the guidelines for perioperative practice that dictate exactly how the sterile field should be set up, how sterile items should be opened and transferred, and how traffic should be managed. SP technicians must understand AORN standards to support the effectively during physical drop-offs. Trap analysis. Option A is wrong because OSHA regulates employee safety like blood exposure, not sterile field clinical practices. It would be correct if the team was updating protocols for handling contaminated sharps after the surgery. Option C is wrong because TJC is an independent regulatory body that inspects the hospital for accreditation, not a nursing professional organization. It would be correct if the hospital was preparing for an unannounced facility-wide quality audit. Option D is wrong because APIC focuses on broad hospital-wide epidemiology and infection tracking. It would be correct if the hospital was investigating a sudden outbreak of healthcare-associated infections across multiple wards. Concept extension. While AORN guidelines are voluntary professional standards, regulatory surveyors like TJC or state inspectors often use them as the legal standard of care to evaluate a facility performance. Question 17. A sterile processing (SP) technician arrives for their shift and prepares to enter the negative pressure decontamination room. Standing at the clean donning station, which specific piece of personal protective equipment, PPE, must the technician physically put on first to establish the primary barrier? A. The heavy-duty decontamination gloves. B. The transparent fluid-resistant face shield. C. The fluid-resistant long-sleeved gown. D. The N95 respirator or standard surgical mask. Correct answer C. Knowledge point explanation. Core rationale. The CDC sequence for donning putting on PPE is designed to build the barrier from the body outwards. The gown is always the first item put on to cover the torso and arms, creating the largest and most foundational barrier against splashes before protecting the face and hands. Trap analysis. Option A is wrong because gloves go on absolutely last so they can be pulled tightly over the cuffs of the gown to create a waterproof seal. It would be correct if asking for the final step of the donning sequence. Option B is wrong because the face shield is put on after the mask to protect the eyes and the mask itself. It would be correct if asking what goes on immediately after securing the respiratory protection. Option D is wrong because the mask is put on second, after the gown is secured. It would be correct if asking what is the first piece of facial PPE applied. Concept extension. The gown must be fully fastened at the neck and the back to ensure no street clothes or scrubs are exposed to contaminated aerosol spray. Question 18. While working at the 3-compartment sink, a sterile processing (SP) technician is manually scrubbing a heavily soiled rigid suction stylet with a stiff nylon wire brush. To strictly prevent the aerosolization of bloodborne pathogens into the technician breathing zone, how must this physical brushing action be performed? A. Brushing the instrument vigorously above the surface of the detergent water to visually inspect soil removal. B. Brushing the instrument completely submerged below the surface of the detergent water. C. Brushing the instrument under a continuous stream of hot running tap water. D. Using high-pressure medical air to blow the biological debris out of the lumen before brushing. Correct answer B. Knowledge point explanation. Core rationale. Aerosolization is the dangerous process where contaminated droplets become airborne and can be inhaled or land on mucous membranes. The strictest safety rule in manual cleaning is to keep the instrument and the brush completely submerged below the surface of the water during scrubbing. The water acts as a physical barrier that absorbs all the kinetic energy and captures any contaminated splashes or aerosols. Trap analysis. Option A is wrong because brushing above the water creates a massive cloud of infectious aerosols. It would be correct if the technician was using a lighted magnifying glass to inspect a completely clean, dry instrument on the prep and pack side. Option C is wrong because running tap water creates splashing that spreads contaminants onto the technician PPE and surrounding counters. It would be correct if the technician was performing the final thorough rinse step with the instrument pointed downward to avoid splashing. Option D is wrong because blowing high-pressure air through a dirty lumen will violently aerosolize blood and tissue. It would be correct if the technician was using compressed air to dry the internal lumen of an already disinfected instrument on the clean side. Concept extension. Friction is the most important component of manual cleaning, but it must be applied safely. Technicians must use the correctly sized brush for lumens to ensure friction is applied to the entire inner wall without causing splattering upon withdrawal. Question 19. A sterile processing (SP) technician is physically pushing a stainless steel cart through the sterile storage aisles to pull instruments for a laparoscopic appendectomy. Based on the medical suffix of this word, the technician knows they must physically select specific instruments designed to perform which action? A. The surgical repair or cosmetic shaping of a body part. B. The visual examination of an internal body cavity using a camera. C. The complete surgical excision and removal of an organ. D. The creation of a permanent new artificial opening to the outside of the body. Correct answer C. Knowledge point explanation. Core rationale. Medical terminology relies on specific suffixes to denote the procedure. The suffix ectomy universally means surgical removal or excision. Therefore, an appendectomy translates to the surgical removal of the appendix, requiring instruments like surgical staplers or heavy scissors. Trap analysis. Option A is wrong because surgical repair uses the suffix plasty like rhinoplasty. It would be correct if the procedure listed was a joint arthroplasty. Option B is wrong because a visual exam uses the suffix scopy like arthroscopy. It would be correct if the procedure listed was a diagnostic laparoscopy. Option D is wrong because creating an artificial opening uses the suffix ostomy like colostomy. It would be correct if the procedure was a tracheostomy to secure an airway. Concept extension. Other critical suffixes for SP techs include otomy meaning making a surgical incision into, like a craniotomy, and itis meaning inflammation, like appendicitis, which is the reason for the appendectomy. Question 20. An operating room, or nurse urgently calls the sterile processing department, SPD, requesting an emergency major instrument tray for a patient who is actively hemorrhaging and requires the immediate surgical removal of the uterus. To quickly pull the correct tray from the sterile storage shelves, the technician must physically look for a label indicating which specific procedure. A. Dilation and curettage. B. Bilateral salpingo-oophorectomy. C. Hysteroscopy. D. Hysterectomy. Correct answer D. Knowledge point explanation. Core rationale. In medical terminology, the root hyster means uterus, and the suffix ectomy means surgical removal. Combined, a hysterectomy is the surgical removal of the uterus. The SP technician must immediately locate the tray labeled hysterectomy or major GYN to provide the heavy clamps and retractors needed for this organ removal. Trap analysis. Option A is wrong because a dilation and curettage uses curettes to scrape and remove only the endometrial lining inside the uterus, not the organ itself. It would be correct if the patient was having a biopsy of the uterine wall. Option B is wrong because a bilateral salpingo-oophorectomy is the removal of the fallopian tubes salpingo and ovaries oophore, leaving the uterus intact. It would be correct if the patient had severe ovarian cysts. Option C is wrong because a hysteroscopy uses a lighted camera scopy to visually examine the inside of the uterus. It would be correct if the surgeon was simply looking for the source of abnormal bleeding without removing the organ. Concept extension. A total abdominal hysterectomy set will include heavy, toothed instruments like Heaney or Ballantine clamps specifically designed to grasp the tough uterine ligaments without slipping. Question 21. A sterile processing (SP) technician is physically scrubbing a heavy loaner orthopedic tray contaminated with a thick-walled microorganism, specifically Staphylococcus. While applying mechanical friction, the technician visualizes their microbiology training regarding how this gram-positive bacterium would appear under a microscope after a standard staining procedure to understand its biological resistance. What specific color would these bacteria appear? A. Pink. B. Red. C. Purple. D. Blue. Correct answer C. Knowledge point explanation. Core rationale. In microbiology, the Gram stain is a critical test. Gram-positive bacteria like Staphylococcus possess a very thick peptidoglycan cell wall that firmly retains the primary chemical stain, which is crystal violet. Because this primary dye is not washed out during the decolorization step, the bacteria appear dark purple under the microscope. Trap analysis. Option A is wrong because pink is the final color of Gram-negative bacteria after they lose the primary stain and take up the safranine counterstain. It would be correct if the report identified Pseudomonas. Option B is wrong because red is essentially the same as pink in this context, representing Gram-negative organisms. It would be correct if the bacteria was Escherichia coli. Option D is wrong because blue is not a standard outcome of the Gram stain process. It would be correct if the question asked about an acid-fast stain using methylene blue as a counterstain. Concept extension. Staphylococcus is a spherical cocci Gram-positive bacterium often found on human skin, making strict hand hygiene and proper PPE essential for SP technicians to prevent contaminating sterile trays. Question 22. A sterile processing SP technician is preparing a fresh 5-gallon batch of enzymatic detergent in the main decontamination 3-compartment sink. The manufacturer instructions for use, AFU, explicitly state that the chemical solution must be maintained at a neutral level to safely clean the delicate stainless steel instruments without causing corrosive pitting. To verify this precise chemical level before physically submerging the instruments, what specific measurement is the technician checking? A. Temperature. B. pH. C. Moisture. D. Humidity. Correct answer B. Knowledge point explanation. Core rationale. The measure of alkalinity or acidity is defined by the pH scale, which ranges from 0 to 14. A pH of 7 is exactly neutral like pure water. Enzymatic detergents used in SP generally require a neutral or slightly alkaline pH to effectively break down biological soils like blood without chemically damaging the passive oxide layer of stainless steel instruments. Trap analysis. Option A is wrong because temperature measures heat, not acidity. It would be correct if the technician was using a thermometer to ensure the water was between 109 degrees Fahrenheit and 140 degrees Fahrenheit for optimal enzyme activation. Option C is wrong because moisture refers to the physical presence of liquid water droplets. It would be correct if the technician was checking the inside of a sterilized peel pouch for wet packs. Option D is wrong because humidity measures the amount of invisible water vapor in the air. It would be correct if the technician was verifying the climate control in the sterile storage area, which must not exceed 70% humidity. Concept extension. Highly alkaline detergents pH 10 to 11 are often used in automated mechanical washers to compensate for the lack of manual friction, but they require a neutralizing acid rinse afterward. Question 23. A sterile processing SP technician is physically pushing a leak testing brush through the working channel of a flexible bronchoscope at the decontamination sink. The technician is specifically targeting a notorious water-loving bacterium called Pseudomonas aeruginosa to prevent a thick biofilm from forming. When visualizing the microbiological profile of this specific pathogen to ensure thorough mechanical removal, the technician knows it is identified by which distinct physical shape. A. Spherical. B. Spiral. C. Rod. D. Comma. Correct answer C. Knowledge point explanation. Core rationale. In microbiology, bacteria are classified by their shape. Pseudomonas aeruginosa is a classic rod-shaped bacterium scientifically known as a bacillus. It is a highly motile gram-negative pathogen that thrives in moist environments like SP sinks and wet endoscope lumens and is a primary creator of highly resistant biofilms that technicians must aggressively brush to remove. Trap analysis. Option A is wrong because spherical bacteria are called cocci. It would be correct if the infection outbreak was caused by Staphylococcus aureus. Option B is wrong because spiral bacteria are called spirilla or spirochetes. It would be correct if the question asked about Treponema pallidum, the bacterium that causes syphilis. Option D is wrong because comma-shaped bacteria are called Vibrio. It would be correct if the question was about Vibrio cholerae. Concept extension. Because Pseudomonas loves water, any residual moisture left inside a flexible endoscope after reprocessing provides the perfect environment for it to rapidly multiply. This is why forced air drying is a mandatory final step. Question 24. A newly hired sterile processing (SP) technician is physically assembling a complex 20-pound surgical tray at a stainless steel workstation while reading a recipe card filled with complex medical word roots and suffixes. When the technician asks the lead SP educator why decoding this extensive vocabulary is practically necessary for their daily physical workflow of placing instruments into the tray, what is the most accurate professional justification the educator should provide? A. To accurately translate the Latin and Greek origins of modern surgical instrumentation for the facility archives. B. To solely enable the technician to read the final instrument count sheet during the preparation and packaging phase. C. To enable the technician to decode surgical requests so they can accurately provide the operating room, or, with the specific trays and services needed. D. To allow the technician to write official infection prevention guidelines using standardized medical terminology. Correct answer C. Knowledge point explanation. Core rationale. The SP department is a customer service department, and the OR is its primary customer. The functional purpose of learning medical terminology is to understand the language of the OR. When a tech reads a surgical schedule listing a cholecystectomy, they must decode that medical term to know the surgeon is removing a gallbladder and will physically need long laparoscopic instruments and clip pliers built into their case cart. Trap analysis. Option A is wrong because translating historical origins is an academic exercise, not a practical workflow task. It would be correct if the tech was studying for a linguistics degree rather than working in a fast-paced hospital. Option B is wrong because terminology is needed for much more than just count sheets, including answering phone calls from the OR, building case carts, and prioritizing the decontamination workload. It would be correct if the tech-only job was quality assurance on the clean side. Option D is wrong because writing infection guidelines is the job of the infection preventionist or organizations like APIC, not an SP technician. It would be correct if the tech had transitioned to an administrative public health role. Concept extension. A deep understanding of anatomy and terminology also helps the SP tech identify missing components on a tray, knowing that an osteotome must logically be accompanied by a mallet to cut bone. Question 25. A sterile processing (SP) technician is physically pulling a heavy sterilizer carriage out of the autoclave when a team of unannounced external inspectors suddenly enters the area to conduct a rigorous on-site evaluation of the physical instrument reprocessing workflow and records. Which of the following independent accrediting organizations is actively performing this regulatory facility-wide survey? A. The Society of Gastroenterology Nurses and Associates, SGNA. B. The Association for Professionals in Infection Control and Epidemiology, APIC. C. The American National Standards Institute, ANSI. D. The Joint Commission, TJC. Correct answer D. Knowledge point explanation. Core rationale. The Joint Commission, TJC, is a highly influential independent not-for-profit organization that evaluates and accredits healthcare organizations. They conduct rigorous unannounced on-site surveys. If a facility fails a TJC survey, they can lose their accreditation, which typically results in the loss of federal Medicare and Medicaid funding, effectively shutting down the hospital. Trap analysis. Option A is wrong because SGNA is a voluntary professional organization that writes specific guidelines for gastroenterology and endoscopy nurses, not an accrediting body that performs regulatory hospital surveys. It would be correct if the SP educator was looking for a textbook on how to properly handle flexible endoscopes. Option B is wrong because APIC is a voluntary professional organization focused on education and epidemiology guidelines, not hospital accreditation. It would be correct if the SP manager was attending a national conference on preventing healthcare-associated infections. Option C is wrong because ANSI accredits standards developing organizations like AAMI to ensure their standard creation process is fair, but they do not step foot inside hospitals to inspect them. It would be correct if the question asked who oversees the creation of the AAMI ST79 document. Concept extension. During a TJC survey, inspectors will frequently stop frontline SP technicians to ask them direct questions about their workflow, trace specific instruments from the Deccan, and demand to see the manufacturer-validated IFU to prove compliance. Question 26. A sterile processing SP technician is physically standing in the clean donning area, actively putting on a fluid-resistant gown and heavy-duty gloves before stepping into the negative pressure decontamination room. The clinical educator observes this physical action and notes these barrier garments legally protect the employee from infectious bloodborne pathogens. According to the Occupational Safety and Health Administration, OSHA, what is the official regulatory term for this specialized attire being physically worn? A. Professional protection garments. B. Personal protective equipment. C. Personal safety attire. D. Protective uniforms. Correct answer B. Knowledge point explanation. Core rationale, personal protective equipment, PPE, is the specific legally defined term used by regulatory agencies like OSHA, the CDC, and the FDA. It refers to specialized clothing or equipment worn by an employee for protection against infectious materials like bloodborne pathogens or hazardous chemicals. In the decontamination area, standard PPE includes a hair covering, face shield or goggles, mask, fluid-resistant gown, heavy-duty gloves, and shoe covers. Trap analysis. Options A, C, and D are wrong because while they generally describe the function of the clothing protecting the professional, they are not the official universally recognized legal terminology mandated by OSHA standards. They would be correct if the question asked for a layman description of the gear rather than the regulatory term. Concept extension. Employers are legally required by OSHA bloodborne pathogens standard to provide appropriate PPE in the correct sizes at no cost to the employee, and they must ensure the employee uses it correctly. Question 27. While physically assembling a complex cardiovascular surgical tray in the clean preparation area, a sterile processing, SP, technician encounters several highly specialized retractors and clamps. The technician uses their training on the physical structure of the human heart and surrounding blood vessels to logically determine exactly where these instruments fit in the tray stringer. Which foundational scientific discipline directly provides this specific knowledge of body structures and their locations? A. Microbiology. B. Medical terminology. C. Anatomy. D. Physiology. Correct answer C. Knowledge point explanation. Core rationale. Anatomy is the study of the physical structure of the body and the physical relationships between its parts, like knowing where the femoral artery is located. By understanding anatomy, SP technicians can logically deduce what instruments are needed, how they will be used on a specific body part, and why they have a certain shape or size, drastically improving tray assembly accuracy. Trap analysis. Option A is wrong because microbiology is the study of microscopic organisms like bacteria and viruses, which relates to decontamination and sterilization, not instrument identification. It would be correct if the technician was studying how biofilms form on a bronchoscope. Option B is wrong because medical terminology is the study of the language used to describe the procedures, like the names of the surgeries, not the physical layout of the body itself. It would be correct if the technician was decoding the word endarterectomy on the schedule. Option D is wrong because physiology is the study of how the body functions, like how the heart pumps blood, not its static physical structure. It would be correct if the technician was studying the mechanism of blood clotting. Concept extension. Anatomy is often paired with physiology. For example, knowing the anatomy of the skull dictates that a neurosurgery tray will require a heavy perforator drill to breach the bone. Question 28. A sterile processing, SP, technician is physically pulling specific instruments from the sterile storage shelves to rapidly build an emergency case cart for a diabetic patient who has suddenly developed a dangerously low level of sugar in their blood. When the technician logs this urgent physical request into the tracking system, which specific medical term must they use to accurately document the patient acute condition? A. Hyperglycemia. B. Hypothermia. C. Hypoglycemia. D. Hypoxia. Correct answer C. Knowledge point explanation. Core rationale. Medical terminology uses specific prefixes and roots to describe conditions precisely. The prefix hypo means low, under, or below normal. The root glyc refers to sugar or glucose. The suffix emia means a blood condition. Combined, hypoglycemia translates directly to the condition of having abnormally low sugar in the blood. Trap analysis. Option A is wrong because the prefix hyper means high or excessive, so hyperglycemia is high blood sugar. It would be correct if the diabetic patient blood sugar had spiked dangerously high. Option B is wrong because the root therm refers to heat, so hypothermia is dangerously low body temperature. It would be correct if the patient had been exposed to freezing temperatures or prolonged cold irrigation fluid. Option D is wrong because the root ox refers to oxygen and the suffix ia means condition, so hypoxia is low oxygen in the tissues. It would be correct if the patient had stopped breathing and their oxygen saturation dropped. Concept extension. Understanding these common prefixes hypo versus hyper helps SP technicians quickly decode many terms, such as hypotension low blood pressure versus hypertension high blood pressure. Question 29. A sterile processing, SP, technician is physically loading closed carts full of heavily soiled biohazardous surgical instruments onto a commercial transport truck at the hospital loading dock. The truck will move these carts over public highways to an off-site reprocessing center. To ensure this physical transport is legally compliant and safe for the public, the technician must strictly adhere to the mandatory packaging regulations enforced by which federal agency? A. The Association for Professionals in Infection Control and Epidemiology, APIC. B. The Department of Transportation, DOT. C. The Occupational Safety and Health Administration, OSHA. D. The Environmental Protection Agency, EPA. Correct answer B. Knowledge point explanation. Core rationale. Whenever biohazardous materials like soiled surgical instruments are transported on public roads outside of a facility private property, the process falls under the legal jurisdiction of the Federal Department of Transportation, DOT, and state transportation agencies. DOT regulations mandate specific rigid packaging, secondary containment, and highly visible biohazard labeling to protect the public and the environment in the event of a traffic accident. Trap analysis. Option A is wrong because APIC is a voluntary professional organization that issues guidelines, not a federal regulatory agency that enforces laws on public highways. It would be correct if the hospital was looking for best practice guidelines for internal infection tracking. Option C is wrong because OSHA regulates employee safety within the workplace like inside the hospital or the truck cab, but DOT regulates the actual movement of hazardous goods on public roads. It would be correct if the question asked which agency mandates the truck driver bloodborne pathogen training. Option D is wrong because the EPA regulates the final disposal of hazardous waste and the safety of chemical disinfectants, not the physical transport of reusable biohazardous items. It would be correct if the hospital was dumping hundreds of gallons of toxic chemicals down the drain. Concept extension. Transport vehicles moving these biohazard carts must be fully enclosed, and the carts must be secured to prevent any movement or tipping during transit, separating the clean delivery items from the soiled returns. Question 30. A sterile processing, SP, technician is manually washing a set of delicate micro-ophthalmic instruments in the decontamination area using the standard 3-sink method. After thoroughly physically brushing the instruments under the surface of the enzymatic detergent in the first sink, the technician must physically move them to the next station. What is the specific dedicated purpose of the second sink in this physical workflow? A. To provide a highly alkaline soak that neutralizes any remaining enzyme residue. B. To perform the critical final rinse using highly purified, deionized or reverse osmosis water. C. To serve as a dedicated handwashing station for the technician before handling the cleaned items. D. To perform a preliminary rinse with plain tap water to remove the dirty detergent and loosened gross soil. Correct answer D. Knowledge point explanation. Core rationale. The industry standard 3-sink method for manual cleaning is strictly organized. Sink 1 is for washing with detergent. Sink 2 is dedicated solely to the preliminary rinse using plain tap water to flush away the dirty detergent solution and suspended soil. Sink 3 is for the final, critical rinse using treated or purified water. This deliberate separation prevents the chemicals and bioburden from Sink 1 from cross-contaminating the pure water in Sink 3. Trap analysis. Option A is wrong because alkaline solutions are generally not used in manual sink cleaning as they are for mechanical washers, and the second sink is for plain water rinsing, not chemical soaking. It would be correct if describing the neutralizing rinse cycle inside an automated washer. Option B is wrong because the final purified water rinse occurs in the third sink, not the second. It would be correct if the question specifically asked for the purpose of the final third compartment. Option C is wrong because sinks used for instrument cleaning are highly contaminated and must never be used for handwashing. A separate dedicated handwashing sink is legally required. It would be correct if asking about a separate ceramic sink located by the exit door of the deck-in room. Concept extension. The final rinse in the third sink using purified water is absolutely crucial because it removes the hard water minerals like calcium and chlorides present in regular tap water, which would otherwise cause staining and corrosive pitting during the high heat of sterilization. Question 31. A sterile processing, SP, technician is vigorously brushing a soiled orthopedic reamer in the decontamination sink to physically remove a sticky layer of biofilm. To fully comprehend why this rigorous mechanical action is critical to prevent patient surgical site infections, SSIs, the technician relies on their foundational knowledge of which specific scientific discipline? A. Biology. B. Immunology. C. Microbiology. D. Pathology. Correct answer C. Knowledge point explanation. Core rationale. In medical terminology, micro means small, bio means life, and logi means the study of. Microbiology is the study of microorganisms like bacteria, viruses, and fungi. SP technicians must understand microbiology to know exactly what invisible pathogens like Pseudomonas or Staphylococcus they are fighting and how these organisms survive via mechanisms like biofilms. Trap analysis. Option A is wrong because biology is the broad study of all life including plants and large animals, which is too general. It would be correct if studying general ecosystems. Option B is wrong because immunology is the study of how the human body immune system fights infection, not the study of the pathogens themselves on instruments. It would be correct if asking how a patient white blood cells react to an SSI. Option D is wrong because pathology studies the physical effects and damage of diseases on human tissue. It would be correct if a doctor was examining how a tumor alters liver tissue. Concept extension. Pathogenic microorganisms are the specific subset of microbes that cause disease, and destroying them completely is the ultimate goal of the entire sterile processing cycle. Question 32. A sterile processing, SP, technician is physically loading a heavy, multi-level orthopedic cart into an automated mechanical washer disinfector. To ensure the high-pressure water jets can physically strike the instrument surfaces with maximum force without being buffered by air pockets, the technician must verify the specific enzymatic detergent used is formulated to be A. Highly alkaline with a pH of 11. B. Low acidic to neutralize mineral scale. C. Low foaming or non-foaming. D. Low temperature activated. Correct answer C. Knowledge point explanation. Core rationale. Detergents used in mechanical cleaners must be low foaming. High foam acts like a physical cushion that absorbs the kinetic energy of the spray arms and creates air pockets inside instrument lumens. This buffering prevents the water and chemical action from reaching the bioburden, resulting in a failed cleaning cycle. Trap analysis. Option A is wrong because while alkaline detergents are used in washers to break down fat, alkalinity itself does not prevent the buffering of spray arms. It would be correct if asking what chemical property specifically breaks down heavy orthopedic bone marrow. Option B is wrong because acids are used for neutralizing or descaling, not as the primary wash detergent. It would be correct if asking about the final neutralizing rinse step. Option D is wrong because mechanical washers use high heat up to 200 degrees Fahrenheit for thermal disinfection, not low temperatures. It would be correct if asking about the optimal temperature for the initial manual enzymatic soak at the sink to prevent protein coagulation. Concept extension. If a technician accidentally pours a high-foaming manual sink detergent into an automated washer, the machine can overflow, and the entire load must be re-washed. Question 33. While physically working at the 3-compartment sink in the negative pressure decontamination area, a sterile processing (SP) technician receives a highly delicate, $15,000 flexible ureteroscope. To safely and effectively manually reprocess this specific device without causing physical damage or leaving residual bioburden, the technician must simultaneously apply their physical skills and knowledge of which three critical competencies. A. Steam sterilizer operation, sterile packaging techniques, and biological monitoring. B. Patient anatomy, sterile field setup, and surgical suturing techniques. C. Inventory management, case cart purchasing, and vendor contract negotiations. D. Microbiology, cleaning and disinfecting processes, and proper instrument identification. Correct answer D. Knowledge point explanation. Core rationale. Working in the decontamination area requires a strict combination of 3 core knowledge bases. Microbiology, understanding the pathogens and biofilms being removed. Cleaning processes, knowing correct chemical dilutions, water temperatures, and brushing techniques. Instrument identification, knowing a delicate flexible scope cannot be submerged or brushed the same way as a solid stainless steel retractor. Trap analysis. Option A is wrong because operating sterilizers and packaging are tasks performed strictly on the clean side of the department, not in decontamination. It would be correct if the technician was assigned to the sterilization and prep zone. Option B is wrong because setting up the sterile field and suturing are clinical tasks performed by the surgical scrub nurse or surgeon. It would be correct if the question asked about the role of the surgical team in the operating room. Option C is wrong because purchasing and contracts are administrative duties. It would be correct if asking about the daily responsibilities of a supply chain or materials manager. Concept extension. A failure in any one of these 3 areas in Deccan leads to catastrophic results. Failing to identify a powered drill before submerging it will permanently destroy the motor. Question 34. While physically assembling a minor plastic surgery tray at an illuminated workstation in the clean preparation area, a sterile processing (SP) technician reads the printed count sheet that requires a specific needle for a subcutaneous injection. By decoding this medical term, the technician knows they must physically select a needle size to deliver medication into which precise anatomical location. A. Directly into the lumen of a major blood vessel. B. Into the tissue layer located just beneath the skin. C. Into the deep layers of skeletal muscle tissue. D. Directly into the synovial fluid of a joint cavity. Correct answer B. Knowledge point explanation. Core rationale. In medical terminology, the prefix sub means under or beneath, and the root cutaneous refers to the skin. Therefore, subcutaneous translates directly to the tissue layer physically located beneath the skin, the adipose or fat layer. The technician must select a short needle designed to reach only this shallow depth. Trap analysis. Option A is wrong because delivering medication into a blood vessel is termed intravenous, intra meaning within, venous meaning vein or interarterial. It would be correct if the count sheet asked for an 4 catheter. Option C is wrong because muscle is much deeper than the subcutaneous layer. It would be correct if the term was intramuscular, intra meaning within, muscular meaning muscle. Option D is wrong because joint cavities are completely separate structures. It would be correct if the term was intra-articular, articular meaning joint. Concept extension. Understanding these directional prefixes sub, supra, intra, inter is vital for SP techs to differentiate between similarly named instruments, such as subcostal under the rib versus intercostal between the ribs retractors. Question 35. Before physically releasing a heavy 20-pound implant tray to the operating room, or a sterile processing, SP, technician retrieves and incubates a biological indicator vial that was physically run alongside the load in a 270 Fahrenheit steam sterilizer. The technician knows the Geobacillus stereothermophilus microorganisms inside the vial are used for testing because they form a thick, highly resistant dormant structure that is extremely difficult to physically kill. What is the specific scientific name for this survival structure? A. A protective cell membrane. B. A cellular ribosome. C. A viral protein capsid. D. A bacterial spore or endospore. Correct answer D. Knowledge point explanation. Core rationale. A bacterial spore or endospore is a highly resistant, dormant non-living shell formed by certain bacteria like Geobacillus or Clostridium to survive extreme environmental stress, such as severe heat, lack of water, or chemical exposure. Because spores are the hardest biological entities to destroy, SP sterilizers are validated specifically against their destruction to guarantee a 100% sterile tray. Trap analysis. Option A is wrong because a standard cell membrane is the semi-permeable boundary of normal, active vegetative bacteria and melts easily under steam. It would be correct if asking what structure controls fluid entering a normal vegetative bacterium. Option B is wrong because a ribosome is the internal structure that synthesizes proteins in an active cell. It does not provide heat resistance. It would be correct if asking where protein production occurs in a vegetative cell. Option C is wrong because a capsid is the protective shell of a virus, and biological indicators use extremely tough bacteria, not viruses. It would be correct if asking about the outer structure of the hepatitis C virus. Concept extension. Geobacillus stereothermophilus is chosen specifically for steam and hydrogen peroxide sterilization testing because it is a thermophile, meaning it naturally loves and resists high heat. Question 36. A sterile processing, SP, technician is physically pushing a case cart through the sterile storage aisles to assemble a 25-pound trauma tray for a patient who sustained a severely fractured femur in a motor vehicle accident. To ensure they physically pull the correct orthopedic power drill and titanium screw set from the shelves, the technician must look for which specific surgical abbreviation on the pick list? A. CABG. B. BSO. C. ORIF. D. HTA. Correct answer C. Knowledge point explanation. Core rationale. ORIF stands for open reduction internal fixation. It is the classic orthopedic surgical procedure used to repair a severely fractured bone. Open reduction means making a surgical incision to realign the bone fragments, and internal fixation means using hardware like metal plates, pins, and screws to hold the bone together internally. The SP tech must recognize this abbreviation to physically supply the correct heavy orthopedic instruments. Trap analysis. Option A is wrong because a CAD coronary artery bypass graft is a cardiovascular surgery to bypass blocked heart arteries. It would be correct if the patient was suffering from severe coronary artery disease. Option B is wrong because a BSO bilateral salpingo-oophorectomy is a gynecological surgery to remove the fallopian tubes and ovaries. It would be correct if the patient had severe ovarian cancer. Option D is wrong because a TAH total abdominal hysterectomy is the surgical removal of the uterus. It would be correct if the patient required an emergency uterine removal due to hemorrhaging. Concept extension. The opposite of an open reduction is a closed reduction CR, where the doctor physically manipulates and realigns the bone from the outside of the body without making a surgical incision, often followed by casting. Question 37. A lead sterile processing (SP) technician is physically demonstrating a new workflow at the prep and pack station to a group of trainees to address a recent spike in delayed operating room, or start times. To actively identify and physically improve how the SP department internal systems affect the quality of patient care, which specific action is the technician demonstrating? A. Modifying the manufacturer-validated sterilization parameters on the autoclave screen to shorten the cycle time and deliver trays to the OR faster. B. Actively executing a standardized tray assembly checklist with or staff feedback to physically prevent instrument waste and missing items. C. Refusing to physically process any vendor loaner trays that arrive without a 48-hour advance notice, regardless of patient emergencies. D. Physically relocating the biological indicator incubators into the negative pressure decontamination room to centralize all testing equipment. Correct answer B. Knowledge point explanation. Core rationale. Professional SP technicians must understand how their department functions as a critical system that directly impacts OR success. Executing standardized checklists physically improves the knowledge system. Integrating OR feedback improves the communication system to identify root causes of delays, and preventing instrument waste improves the financial and inventory systems. These combined physical actions directly elevate the quality of patient care. Trap analysis. Option A is wrong because altering validated parameters violates strict FDA and AAMI regulations and guarantees unsterile trays. It would be correct if the question asked for an example of a dangerous physical practice that causes patient harm. Option C is wrong because outright refusing to wash trays during an emergency puts the patient life at risk, failing the primary goal of patient care. It would be correct if asking about a poorly managed administrative policy that ignores clinical needs. Option D is wrong because physically placing clean BI incubators into the highly contaminated decontamination room violates strict one-way workflow and introduces severe cross-contamination risks. It would be correct if asking for a critical physical workflow violation. Concept extension. Quality assurance in SP is not just about passing an audit. It is about continuous proactive physical communication and checking between the OR and SPD to refine the system so errors are caught before a tray ever leaves the sterile storage shelves. Question 38. A transport orderly arrives from the labor and delivery ward physically pushing a closed, biohazard labeled cart containing 30 pounds of bloody surgical instruments from an emergency cesarean section. To strictly maintain the facility infection control protocols regarding one-way workflow, the orderly must physically deliver this heavily soiled cart through the dedicated doorway of which specific area of the SPD? A. The clean preparation area. B. The sterile packaging area. C. The negative pressure decontamination area. D. The high temperature sterilization area. Correct answer C. Knowledge point explanation. Core rationale. The foundational architectural principle of the sterile processing department is the strict one-way flow of materials from dirty to clean. The decontamination area is the only space specifically designed, physically isolated, and negatively pressurized to safely receive, handle, and process soiled biohazardous items. This is the absolute physical starting point of the reprocessing cycle. Trap analysis. Option A and Option B are wrong because the preparation and packaging areas are classified as clean semi-restricted zones. Pushing a bloody cart into these areas would cause catastrophic cross-contamination of all ready-to-sterilize trays. They would be correct if the orderly was delivering newly washed and thermally disinfected instruments from the washer-unloader. Option D is wrong because sterilization occurs only after instruments have been completely physically cleaned, inspected, and packaged. It would be correct if an SP tech was loading a finished tray into the autoclave. Concept extension. If a clean item is accidentally physically dropped on the floor in the sterile storage area, it is considered contaminated and must instantly be carried all the way back to the decontamination area to start the entire physical process over again. Question 39. While physically inspecting the long flexible insertion tube of a complex gastrointestinal endoscope at a lighted workstation in the clean assembly area, a sterile processing (SP) educator quizzes a new technician about the human anatomy it physically enters. The educator explains that the stomach, liver, and intestines all physically work together to digest food. In medical terminology, this specific grouping of multiple different organs working together to perform a major biological function is officially classified as A. Human body system. B. Single anatomical organ. C. Biological tissue layer. D. Microscopic cellular membrane. Correct answer A. Knowledge point explanation. Core rationale. The human body is organized in a strict structural hierarchy. When a group of distinct, different organs like the stomach, liver, and intestines physically connect and work together to carry out a complex, specific activity like digestion, they form a body system, in this case, the digestive system. Trap analysis. Option B is wrong because a single organ like just the stomach is made of tissues, not other organs. It would be correct if the educator was physically pointing exclusively to the liver itself on an anatomy chart. Option C is wrong because tissue is composed of a group of similar cells working together like muscle tissue, not entire organs. It would be correct if physically discussing the epithelial lining inside the stomach. Option D is wrong because a cell membrane is the outer boundary of a single microscopic cell. It would be correct if discussing how nutrients pass through the wall of a single red blood cell. Concept extension. The hierarchy of the human body from smallest to largest is cells, tissues, organs, systems, organism. Question 40. A sterile processing, SP, technician is physically prioritizing the assembly of a heavy 20-pound major abdominal surgical tray at their clean workstation for an upcoming oncology case. The surgical schedule indicates the patient has severe gastric cancer and requires the complete surgical excision and physical removal of their stomach. By decoding the medical terminology, the technician knows they must locate the pick list for which specific procedure? A. Gastritis. B. Gastrectomy. C. Gastric bypass. D. Sleeve gastrectomy. Correct answer B. Knowledge point explanation. Core rationale. In medical terminology, the root gastra refers to the stomach, and the suffix ectomy means surgical removal or excision. Combined, a gastrectomy is the general medical term for the surgical procedure to physically remove all or part of the stomach. The technician will need to prepare a tray with heavy abdominal retractors like a bookwalter and intestinal staplers for this major organ removal. Trap analysis. Option A is wrong because the suffix itis means inflammation. Gastritis is the inflammation of the stomach lining, which is treated with medication, not surgery. It would be correct if a patient was taking antacids for an upset stomach. Option C is wrong because a gastric bypass physically alters the stomach to route food directly to the small intestine for weight loss, but it does not completely remove the organ. It would be correct if the patient was undergoing bariatric surgery for severe obesity. Option D is wrong because a sleeve gastrectomy specifically removes about 80% of the stomach to form a thin tube for weight loss. While it is a type of gastrectomy, option B is the most accurate, general term for the complete excision of the organ due to cancer. It would be correct if the procedure specifically described creating a narrow stomach pouch. Concept extension. A total gastrectomy complete removal requires the surgeon to physically connect the esophagus directly to the small intestine jejunum so the patient can still process food without a stomach reservoir.